Okay, assalamu alaikum. We have this case of a complete denture, and the patient had a complaint in the lower part. So I asked the student to use the tool we talked about yesterday, which is using rubber and fitting the denture with a closed mouth technique to check the problems if there were problems. Now, your first comment, when I asked you where was the heavy spot, what did you say?
The lower right side.
In lower right side. This is where she's in pain. So it's this one. Okay? This is where the patient is in pain. But the idea when we talked about, you were guessing that anything wiped away that's a high spot? That was, yes. No, I'm with you with this comment. If it was a discrete, let's say, it's an island between other, let's say, if I have all rubber here and I have this area exposed, okay, this is a high spot because I have rubber here, I have space, so it's preventing the fitting. But actually when you have all of this wiped away, that's a good fitting. Okay, so how am I going to check where is the area that has a high pressure? I'm going to look to this criteria, as I said, something that is wiped away with a lot of rubber around. Where did I lose the fit?
In the anterior?
Anteriorly, and this was the case where we had a knife edge ridge. Okay, so see this? This is an area exposed between, it's an island between a lot of rubber. So it is an area of high pressure. While these, I will expect these are adaptation areas. What's about this one? This is also a discrete island within rubber. So this is heavy. Okay, so see how I detect it? Let's go to the other side. Okay, this is a discrete island between a lot of rubber. So it goes with the definition. But when I suppose you had a denture and I did this technique and all of it wiped away, this is excellent adaptation. Okay, so you need to know how to interpret when it's a high spot, when it's adaptation. Because adaptation, what does it mean? You don't have space. The denture is fit on the tissue, and this is, by the way, one of the few dentures, very few, that I've done the technique for, and I find this wide area of adaptation. So your adaptation is excellent. That doesn't mean you're devoid from problems. We have problems, but you have to detect them and diagnose them. Because we don't want to, if you're going to trim from this area, do you know what will happen? You'll have misfit. So I'm losing, this is an advantage. So once more, what I'm looking for an area empty of impression material, and it's surrounded by impression material. So where does this apply? Even if the patient is not in pain, I would tell you, reduce this a bit. See this island? Okay. Reduce this a bit. If I would say also reduce this a bit because there is material around it. Reduce this. Sorry. You might not have seen it. My hand was shaking. Okay. You have to reduce. See this triangle? Yeah. It has impression material around it. So reduce it. It might be the cause why this is not seated. Okay. Go anteriorly. Where do we have the same criteria? An island with rubber around. It's this line. So you have to relieve this, and even if you over relieve it, make it like a dome, you're okay because this is a knife edge ridge. You're fine because you'll get the adaptation from the slopes. You don't want it from the knife edge ridge. So even if it was better not to be fit, okay, there is something here as well. Do you see that the rubber here, and here it's, so I would reduce a little bit from the surface here. Go more. I would see this one. See this one? Yes. Usually those that appear here in the distal, this one and this one, they come from your border molding that the green stick was pushing towards the tissue and you did not detect it. It was unseating the tray. The tray was filled with the impression material, but you haven't seen these pressure spots. So it comes from the green stick. So this video was important for you to understand that, because in many videos I always say that wherever you have exposed area, this is an area of pressure. No, this is an area of adaptation. What is an area of pressure? An area of empty from rubber and surrounded by rubber. Thank you very much.